Thanks for the introduction. And I'm really excited to be here today and to talk about something that I am very passionate about, which is helping kids and teachers, guidance counselors really understand, excuse me, how to take the concepts of learning disabilities or differences, the impact of mental health symptoms, and create what I call an upward spiral. So I want to start by giving you that kind of visual that often when we talk about kids who are experiencing both learning differences and mental health concerns, we see this kind of downward spiral happening. And what we're going to talk about today are the ways in which we can create an upward spiral. So I'm going to start by sharing some slides, and it's going to take me just 1 second to tee these up. I also just wanted to let you know while I'm doing this that the slide notes, my presenter notes, will be included in the slides. And if you'd like a copy, you can ask for a copy to be shared with you. Okay. Here we go. Okay. So Abby mentioned that I am currently participating in the innovation space for pediatric adolescent behavioral health, and that's true. I also am a provider and have been a practitioner for most of my professional career. I'm a nurse practitioner. I started in psychiatry in child and family mental health, gosh, way back in the late 80s. And most of the time since then, I've spent practicing providing care to children and adolescents. I'm board certified in primary care and also have a master's degree in child and family mental health. I choose to use the primary care credential because it allows me to treat the whole child. And that's something that we're going to talk about today, is understanding the whole child. So looking at, what I hope to share with you, what I hope you'll learn today are 4 pretty specific objectives. So one, really learning the differences between learning differences in mental health and understanding how the conditions overlap and what that might mean to you as a teacher or guidance counselor. The second objective is to recognize when some of the behavior challenges that you're seeing in the classroom may in fact have some of these underlying clinical drivers. The next thing we'll talk about is the role of executive functioning, ADHD, anxiety in the classroom, and ways in which you can support children who are experiencing these differences. And the last objective will be to really talk about how do you interact with families. When do you begin to broach the conversation, and ways to engage in partnership with families around what their children are experiencing in your classrooms or your school. So Abby and I did a Q&A of kind of the most frequently asked questions. I'm commonly asked these particular questions. So we thought we'd start with just kind of answering the frequently asked questions. So one of the most common questions I'm asked is, how often does a child in a classroom experiencing learning differences also have mental health issues or mental health concerns? So how frequently are the two linked? And the research is really clear. There is robust information in the literature that supports the connection between learning differences and mental health symptoms and diagnoses. And that it in part speaks to that downward spiral I was talking about. The issues in understanding these differences are really looking at all the different factors, contributing factors. So there are psychological factors in the individual child, there are systemic issues in school dynamics, the family environment. Lots of things contribute to the response of a child who is dealing with both learning differences and mental health symptoms or concerns. In my clinical practice, I see almost a one-to-one correlation between learning differences, some symptoms of anxiety, some symptoms of depression, executive function deficits, and behavioral symptoms. So we're going to talk about this a little bit more in detail. Some of the specific mental health diagnoses that are commonly co-occurring are anxiety, depression, and behavioral symptoms, commonly referred to as oppositional defiant disorder. These are the top three, both in the literature and also what we see in clinical practice. Why that matters when we're looking at the mechanisms in which learning differences can contribute to the development of mental health challenges. You can imagine what it feels like to be a child, and we're talking K through 12. To be a child who is in a classroom, who wants to learn, who's trying to learn, and who is experiencing difficulties like dyslexia, specific language impairments, nonverbal learning disabilities, other specific learning disabilities, um, what it feels like to be sitting in that classroom. So they're trying, they're motivated, they want to learn, and it's harder. And about third grade is when children developmentally start looking around and comparing themselves to others. And so we see a spike in the awareness of difference in third grade, and also the onset of some of the common issues like anxiety, low self-esteem, issues, social issues. Um, these are the things that show up as it relates to the learning differences. If the learning differences are identified and supported, a lot of that can be mitigated. If they're not, you start to see both failure in performance, so difficulty in school and academic struggles, and also the emotional impacts that go along with it. So the low self-esteem, social difficulties, and the mental health challenges, anxiety in particular. Some of the signs or indicators that a learning difference might be impacting a child's mental health. It's really important to think about it holistically. So you might see symptoms or signs that manifest emotionally. So this might be a kid who previously had lots of energy and was really enthusiastic, and now they're they're quiet, more withdrawn, less willing to raise their hand or engage. They might appear sad. They might appear just less animated. You might see this behaviorally. So this is where you might see homework refusal or schoolwork refusal, attempts to avoid tasks, academic tasks that are particularly challenging related to their learning difference. Um, Socially, this shows up with kids comparing themselves to others, feeling like they're not as accomplished or as successful or as smart as their peers. They may withdraw, they may move out of previous friend groups that they were part of because they don't feel like they belong or fit in. And physically, we see lots of stomach aches, so tummy aches, visits to the nurse, asking to leave early, headaches, things of that nature. So these are really the soft signs that something is going on, that teachers and guidance counselors are going to be on the front line of recognizing. So when you notice these differences, it's really important to continue to monitor, and also to have conversations with your teams about, is this appropriate at this point to raise concerns with the family? What should we be doing about this? Which leads to that idea of early intervention. So early intervention is really important I can't state that enough, and you guys know this is better than anybody. The earlier we get in and understand learning differences, the better we are able to potentially mitigate the mental health consequences. So if we recognize learning differences, and I'm talking about a very wide spectrum here, so that's dyslexia, nonverbal learning disabilities, specific learning disabilities. We recognize these things early on. We can identify the right supports and support the child's self-esteem and prevent some of these later mental health issues that are likely to develop. So by identifying early on and assessing for diagnosing if you're outside of the school system, we're talking about diagnosing. If you're inside the school system, in the educational system, we're talking about identification. If we can diagnose and identify early enough, a lot of the downward spiral can be prevented. Often I'm asked, why does self-esteem matter? And when we talk about kids and self-esteem, it's developing. So they're looking around, comparing themselves to their peers. They're taking an input from the adults around them, and all of this is being synthesized into an understanding of, who am I? What am I good at? What's hard for me? Who am I? And self-esteem is really the ability to recognize yourself and also the positive aspects of what your capabilities are. So it's a mediator often between the learning differences in children and the mental health outcomes that we've talked about. So if we can identify early, if we can get the right support plans and learning support in place, we can impact self-esteem in a really positive way that allows kids to understand themselves. So they're able to understand, I have a specific learning disability, I have dyslexia, I have trouble reading. That doesn't mean that they also feel like they're not smart or not capable, like school is too hard and they should quit or give up. So that self-esteem that we're creating, really all across the academic experience for children, is setting them up for success in life. The opposite is true as well. So if we don't identify, or we do identify, but we don't get the right supports in place, it can create this sense of learned helplessness. No matter how hard I try, no matter what I do, I'm not going to be successful. I'm not able to do these math assignments. Everybody's smarter than me. Those are kind of some of the statements that you'll hear in a kid who's engaged in that downward spiral. So when we talk about, Abby introduced Blackbird and some of my early work in the 2014s, the teens of 2000, I had an opportunity to really think about, if I could create a system, if I could design a system that would give kids every chance at an upward spiral, setting them up for success in life, what would that look like? And uh, in 2014, I opened a practice and was really able to implement all of the assessments that I felt were important. So we're talking about whole child assessment, and that includes cognitive, emotional, social, physical development. If there are mental health symptoms, looking at mental health diagnostics, looking at constitutional health, the whole child. And when you do that, you're really able to move beyond a specific issue like a learning difference, and understand the learning difference in context of the whole child, which sets the child and the family up for success. So in 2014, we started with a robust front end evaluation that leads to really targeting. What we're after at Blackbird is to identify root cause as much as we possibly can, given the science that we have. So acknowledging that there are limitations, The claim is not that we can know everything about every child. What the claim is that if we try really hard, we can get close. And that's what Blackbird's assessment was built around. So when you do this kind of assessment, you're able to give context to behaviors, the emotional symptoms that you see, or some of the other things that we've talked about in terms of children in the classroom. You're able to give it context and ultimately identify targeted interventions, highly specific interventions that allow you to address root cause, not just symptoms. Some of the common challenges that families see, individuals and families see when looking to access support. And, I experienced this myself as a mom. My daughter's 24 now, but when she's probably 12 months old when I recognized that she had some language delays. She had some motor differences. And so we started with the medical side of things, trying to figure out what was going on. She had early intervention services starting around the age of 3.5. And it was really navigating both the medical systems, of which I was really familiar, and the educational systems, of which I was not as familiar. Navigating both of those systems to get all of the supports and the interventions that she needed, and that would set her up for success. So one of the challenges that I see families face all the time is, and you may have experienced as teachers and guidance counselors, is the school evaluations will support a classification or a learning difference, but the school evaluations are not diagnosing anything. And it's the medical evaluations that generate a medical diagnosis. And getting the two systems to a place of synthesis is really challenging for your average families. It's one of the issues that really prompted me to start Blackbird. I asked a question, gosh, if it's this hard for me, what must it be like for people who are not connected on the medical side, who don't understand that terminology, or have trouble navigating that system, as well as the educational side. So those are the most common challenges. There's not a common language that translates between medical diagnoses and workups and educational assessments, evaluations, and the generation of IEPs. You may also experience some of that dissonance. That's not uncommon, as I've spent the last 10 years talking to teachers and support teams in schools. The translation is really important and often missing in the situation. So, when we talk about supporting children who have both learning differences and mental health challenges, we're talking about supporting the whole child, and thinking about the behaviors that you see in the classroom, thinking about the learning differences in context to the child's whole life. So, thinking about collaboration with families and other medical providers, if you're teachers and guidance counselors, really looking at how do we individualize these plans of support. If you're talking about an IEP or even a 504 plan, how do we individualize this in the most helpful way for this child? Thinking about trauma-informed approaches. So what's going on, what happened to this child, what happened to this family, or even what happened to this community. In the world today, we have, traumatic events happening in all of those venues. So thinking about how do we approach that together, and fostering the environment where, number one, the most helpful thing that I've seen clinically in the last 11 years is that the child feels understood. Understanding is critical. Feeling understood is critical. It establishes a sense of safety and trust. So if the child feels like you understand them, they extend trust to you. They feel more safe. They can relax. Maybe it helps with their anxiety. Um, they feel more capable. You understand me. You're here to help me and support me. I'm willing to try this again. I think I can do this. And connected. We're in this together. Could you teach me this, the way to do this other problem? And you create that upward spiral in the environment that is positive. It's positive for the child. It's positive for the teacher in the classroom, for the other kids. And it's really leads to success both academically and emotionally. I'm often asked kind of what are some resources, and I think I mentioned before in the slide deck, if you request a copy in the speaker notes, I have extensive resources. So I have favorite books that I recommend, websites. There are also some really good blogs out there. The books, I just made a list of the books. The websites and blogs are in the speaker notes of the slide. But some of the books that I really like, if we're looking at dyslexia, so these are a lot of what I tried to offer were books that have practical tools, things that you can use in the classroom and families can use as well. So Dyslexia Empowerment Plan, Smart but Scattered is a great book looking at the issues of executive function challenges and how that shows up both at home and in the classroom. And there are specific strategies for improving attention, organization, and emotional regulation. The Whole Brain Child is on my shelf and something that I reference frequently. So we're looking at the clinical neuroscience guide, based guide for working with kids with emotional dysregulation. And that is, I'll say, the most common concern that is brought to my attention when I'm working with families and teachers and classroom teachers. Uh, Emotional dysregulation is number one on the list for, the question, how do we manage this? How do we deal with this? And the inputs into emotional dysregulation are multifaceted. And so this book, The Whole Brain Child, looks at the different inputs from a clinical neuroscience perspective that lead to or drive emotional dysregulation. So, one example is a child who has sensory differences and is in a classroom with 26 other kids and has difficulty tolerating all of the noise in the environment. That may be something that the child is not able to describe, talk about to the teacher, explain. What you'll see is the sensory difference leads to this kind of welling up of emotion that eventually turns into an explosion. And so this is a great book for teachers and parents looking at what are the brain-based inputs that are leading to that dysregulation. And then also bright kids who can't keep up. One of my most common findings when I use Blackbird's assessment process is neuroscience based. And one of the most common findings when I'm doing a workup for attention related issues are processing speed issues. So it's common that kids who have difficulty with attention also have issues with processing speed, and it can be faster or slower. So you can see a kid who has super fast processing speed, and what that means is that their brain is taking in information and moving, filtering through it very quickly. And this can often lead to the common behavioral output in the classroom is not reading the whole question or missing instructions, and it's just because their brain is moving so fast. Conversely, you can have very slower processing speed. And in that situation, the academic ability, the cognitive capability of the child could be, very high, phenomenally high. and it's going to take them a little bit longer because their processing speed is slower. And so anytime there's a time test or specific instructions that are in great detail, and the child has to process both the instructions, so really sophisticated instructions for an assignment, and then complete the assignment, that's going to be challenging for a kid who has slower processing. So Bright Kids You Can't Keep Up is a great resource for understanding that particular phenomenon, and then looking at or identifying interventions that might be helpful for the child in your classroom. I'm shifting gears now from talking about the impact of learning differences and mental health symptoms, and talking about some of the changes that I expect will impact teachers and guidance counselors and medical professionals as we move into the proposed budget, federal budget for the nation. And so I thought it would be important to just highlight some of the areas that I see potentially changing and what that means to our current systems. So the next set of slides is really speaking to changes that you should know about as teachers and guidance counselors as we start to rebuild systems. So if we look at the Department of Health and Human Services proposed changes, some of the budget cuts and agency reorganization will have an impact on early intervention services. So not everybody knows that early intervention services are actually funded out of the Department of Health and Human Services. And so, we expect that those early intervention services will be affected, whether it's less funding for early intervention or changing, reorganizing who's administrating early intervention. There'll be structural program changes, things like that. Putting that in your awareness to keep track of, especially kindergarten, first grade, where that intersection between early intervention and education is really tight and important for the child and family. On the Department of Ed side, also looking at budget reductions and program consolidation. There's some talk about doing away with the Department of Education, or reorganizing the Department of Education and minimizing the impacts of federal oversight. So really handing it back to the states through block grants, and then the states will administer the block grants as they see fit. On the Department of Health side, we're looking at workforce reductions, and questions about the capacity for programs that support IDEA. IDEA is the federal law that requires school districts to find and support children with learning differences and medical differences. And so we expect to see some changes there in terms of funding and also the organization of those services. And as I mentioned, the states will move to more control as the Department of Education takes a step back. What that means is that state by state, the legislators of each state will make decisions about how to implement requirements of IDEA at the state level. The Department of Health and Human Services, as I mentioned, administers early intervention. So we're looking at, some at least significant reorganization around those systems and potentially budget and funding cuts as well. And when you look at the Department of Education, there's still similar funding in the proposed budget. It's just looking at who is responsible for the oversight. So right now, states have discretion and create their own implementation systems for IDEA. But they are also audited at the federal level, and are required to meet certain benchmarks. what the new proposed changes would do would be to take away that federal oversight, and it would really be up to the states to ensure that they are meeting the requirements of the law. And that is what I wanted to share with you in terms of the webinar content. And I'm excited now to take your questions and really move from talking to you to with you.
Terrific. Amy, I have 3 questions, 3 very thoughtful questions that have been
Okay.
submitted. The first one focuses on the child. What disorders tend to co-occur with learning differences? Are we talking about ODD, anxiety, depression, or something else?
So the answer is yes. So when we're talking about learning differences, those are the common co-occurring conditions. Excuse me. What I will say is that the prevalence for anxiety and sorry, Abby, I'm trying to stop sharing my screen right now.
Oh, no, you're not sharing. You're
Oh,
good.
great.
Yeah.
Great.
Yeah. All set.
And I want
Just us.
to. Great. Okay. So when we're looking, I'm just moving to my notes. So, when we're talking about what the research says, the diagnoses most common are anxiety, depression, and different anxiety disorders. So OCD, sometimes that kind of sense of need to be perfect. I'm not getting this. This is hard. And so I'm going to try as hard as I can. And it needs to be perfect for it to be acceptable. Those are kind of some of the things that we see related to learning differences and mental health diagnoses. And I also really want to point out that you don't require a medical diagnosis of an anxiety disorder to have symptoms, have anxiety. Anxiety is a feeling. Have it as comorbid to a learning disability. So, if there's no official diagnosis, you will most likely still see these behavioral symptoms in the classroom, and that would be grounds to bring it to somebody's attention, to ask the question. Are we doing all that we can for this child? Are we providing the right sources of support? Maybe they need a medical workup. So really it's for teachers and counselors, it's recognizing the symptoms, and then making recommendations for follow-up and deeper evaluation to truly understand if there's a diagnosis there or not.
Excellent. Thank you. The next one focuses on the educator, actually. I love this question. And I see it as sort of an extension of what we witnessed during COVID, which was a lot of educator burnout, a lot of early retirements, a cleaning out in a devastating way of that group. So the question is, what advice do you have for educators around support and burnout prevention during these stressful times? Because there's the need for the mental health care and learning differences care support is up, yes, and
Yes.
the stress bureaucratically is up. So yeah, what do we say to educators?
Yeah, wow. I am First of all, I'm so glad someone asked that question. And um, second, I would just like to state for the record my undying gratitude and support to teachers. In the last 5 years, teachers have been asked to do the impossible for the unwilling with nothing. I can't remember that quote, but basically, the world flipped on its head, and teachers and administrators and counselors had to immediately pivot. And then it flipped back, and you had to pivot again. And so, I think that in terms of feeling burned out, the experience of burnout, as a human, all the things that you hear about and that you are probably aware of, are really important to put into practice. And I say this as someone who is pretty type A, pretty driven, haven't always been great at self care. And over the last 5 or 6 years, I've really had to lean in and practice what I preach about this. So, self care being number one. And, that is highly individual and worthy of a journey of exploration to figure out what does work for you. And so thinking about yourself and your needs first is really important. Beyond that, I would say the some of the challenges that I see teachers face, especially with learning disabilities, behavioral health or mental health concerns, and responsibilities for implementation of either an IEP goals, or a 504 plan with accommodations. Um, it's been my experience that there's lots of training and development around what is an IEP, what are IEP goals, how do you write them, what goals are appropriate for what problems. And that isn't often translated descriptively, engagingly, with a lot of ideas, creativity in terms of how do you implement these things in the classroom. I think for teachers who have no experience with special education or mental health issues, asking to co-teaching is number one, my favorite burnout prevention. So if we can get a regular education teacher and a special education teacher in the same classroom, you're supporting each other's knowledge strengths and differences. You're supporting each other's um, creativity and impact on each other in terms of your sense of progress and success in the classroom, just kind of like your mental engagement about it. I can't say enough about co-taught classrooms. If you don't have the opportunity to experience a co-taught classroom, I would ask to be a part of a special ed class, to observe, to talk to the special education colleagues, to your special education colleagues, and to lean into the idea that this can benefit every child in your classroom. So, one of my favorite concepts came from a colleague of mine who is a teacher, a therapist. She's been an educator for years. And she talks about uh, teaching from the outside in, and the idea is that if you're teaching to the kids who have the highest needs, the most differences, you are absolutely going to capture the kids who don't, right? The strategies that you're having to use and get creative with to help kids who have differences are also going to capture and engage the kids who don't have those differences. And so thinking about that with joy and enthusiasm and like how and creativity, like how can I make my classroom the ultimate learning experience, is also a way to stay engaged and plugged in and to prevent burnout. um, I think education can help with that as well. So if you're interested, if you have a particular passion for thinking about teaching kids with I don't know, someone like me, when I was a child, I had a math learning disability and also attention issues. If you have a particular area that you're really interested in, dive into it, explore. The number one antidote for burnout is a sense of energy and being able to move forward. And so, really tapping into what you love can also help you do that. And then I would say, be verbal, be vocal, talk about what's going on for you. Talk about what you're seeing, and share your thoughts and ideas and opinions, whether it's to your school administrators, to the families of kids in your class, to each other. It's really through that sharing of ideas and experiences that we as humans are able to grow and learn.
Fantastic. Thank you. Third question.
Mm-hmm.
Third and final. I don't think I see any others. This one focuses on the parents.
Yes.
How do educators help support parents who are ambivalent or may have bias against mental health care for their child?
Yes. Yes. I see you out there. I understand. I can imagine what drives that question. Um, so I think there are different, I'll just use my lived experience around this. Um, it's my experience almost daily to engage with the family and tell them something about their child that either they were really worried about and didn't want to hear, or were hoping that it wasn't, the case. Or they had no idea, they hadn't even thought about it. Now I'm presenting this idea that maybe there's, an issue over here. And so the strategies that I use with families I think of it as kind of like bringing them on the ride. I'm gonna bring you onto the ride of this journey that we're gonna have with your child. And so, really pointing out strengths first. So, every parent wants to hear the good things about their kiddos, right? So, I will open with, wow, we've learned so much about your child, and I can't wait to tell you about their superpowers, like the things that, they're really good at. And so, opening with that is always helpful. And then, hey, we're all human. Everybody has no human is perfect and only has strengths. So, I'd also like to talk about some of the differences that I see, or some of the weaknesses, areas of weakness. And I always use I statements. So I care deeply about your child's success, as I'm sure you do too. And in my opinion, it would be really helpful for us to understand this better, because ultimately we all want the same thing, which is for this child to be successful, to have a great quality of life and perform well and, experience success. And so that's how I approach it. So I start with positive, I lean into engagement. Hey, we're on this in this conversation together. These are the great things I see. These are the things I notice where we may need to do some more investigation. In my opinion, it's really worth checking this stuff out, because over time, this can compound and create that downward spiral, or we can learn about it and begin to create an upward spiral.
Fantastic. That's a lot. Just those three questions are a webinar in themselves.
Well,
So
I did have, I don't know if there's any interest, but I was able to open finally my notes, and I can quote some statistics if that would be helpful. One of the slides that I had talked about early on was related to um, the comorbidities, so learning differences, and of course I just clicked right out of that. Learning differences and things like anxiety. So the risk for an anxiety disorder ultimately developing for a child with dyslexia is 3 times that of a child without dyslexia. So that's a significant increase in risk. Um, the risk for anxiety and depression as it relates to a child that possibly has ADHD is again a threefold increase in risk. So what we're talking about are some of the most common things that you see in the classroom, if there's a learning difference, or a diagnosis, a medical diagnosis. The most common things that you're going to see mean that those kids are placed in a significantly higher risk category for anxiety, depression, and on the kind of longer term development of mental health issues.
yeah,
So, teachers, counselors are on the front line in the same way that my clinicians at Blackbird are, in that, you know, the earlier we see
Mhm.
it, the earlier we address it, the more we work together and collaborate in that kind of whole child approach, the better we able are to mitigate and potentially prevent mental health issues for children.
That says it all right there. And I think with that, we can wrap it up. Thank you so much. Thank you, everyone, for joining. Again, all of this recording and the slides will be included in your follow-up email. So check it out, send it to a friend if it's helpful.
You know, Abby, one other thing, I'm always available for questions, for follow-up questions. So just to make sure that everyone has my email, it's pretty easy. It's A Edgar, so my name, at blackbirdhealth.com. So if you have any questions that you think of after this, you want to address something different, I'm always here and happy to support teachers and counselors in the world. I have tremendous respect and appreciation for what you do.